Hi, my name is Sabrina, and today I'm going to be talking about how technology has helped doctors improve healthcare. So, healthcare has come a very long way. It has improved greatly with the way technology is being advanced. So, I researched many things, for example, procedures that have become less invasive and also machines that are being used during surgery that allow surgeons to be more precise. So, I came across an article that had to do with an orthosurgeon, and he explains in the article how imaging technology improves surgical precision. So, as an orthosurgeon, he gets to perform a spinal fusion surgery. For those who don't know what it is, it involves a bone graft to cause two vertebral bodies to grow together into one long bone. So, without the advantage that surgeons have today, they had to use their best judgment to position the screws. Placing them a little bit to the right or a little bit to the left, even a couple millimeters, could damage a nerve or even the spinal cord. With the advanced imaging technology they have today, it guides surgeons for the placement of each screw. Dr. Santos explains how CT scanners in a surgery room are used to create 3D images of the spine as the surgical team operates. When they place a pedicle screw, they can see the image of the screw as it's being inserted. They know exactly where the screw is going, and then more importantly, they know exactly where it's not going. The outcome of the surgery have shown how safety and accuracy improve using the CT scanners. Advanced imaging is just one example of technology's contribution to healthcare. In the case of Bradley Williams, a 58-year-old man was found with 3 bulging discs and a 2-inch mass on his left kidney. For a general laparoscopic kidney removal, also known as a laparoscopic nephrectomy surgery, can take about 2 to 21 and a half hours. A robot-assisted surgery allows surgeons to do a procedure that were usually open procedures through a minimally invasive route. Traditionally, they would make a 15 to 20-inch incision, which had higher risk infections, greater blood loss, and obviously more pain for the patient. Patients typically spent 5 to 7 days in the hospital. With robotic surgery, they may go home in 1 or 2 days and end up using very little narcotic medicine. Not everyone is a candidate for these types of procedures. It depends on the size and the location of the tumor. Luckily, Mr. Williams was qualified. He had a very complex mass in a very difficult location of the kidney, but with the robot, they were able to save his kidney and his kidney function was not affected. Professional 3D printers in the medical field are being used to create or print a structure in order to replace or support an existing biological structure. In the case of 2-year-old Mina Khan, surgeons were able to build a custom implant to patch a defect in the ventricles of her heart. Using 3D modeling technology, doctors are now able to create temporary implants that are specifically made for that patient. They can customize the size, the shape, and movements of the implant so it fits perfectly in the body. Doctors and scientists around the country are loading 3D printers using human cells and printing living tissue called bioprinting. Bioprinting allows surgeons to print a living organ for transplant using a patient's own cells. An important advantage of bioprinting is patients wouldn't die waiting for organs and their immune systems wouldn't reject the organs. For children, this would mean the tissues could grow with them, eliminating the need for surgeries as they grow. Surgeons are finding that 3D printing technology can reduce operating time, lower risk from errors or complications, and produce better outcomes for patients. With these less invasive surgeries and procedures, the outcomes are so much higher and is less stress for the body to handle. Technology is advancing so quickly that even as we create a new procedure such as laparoscopic surgery, new technologies such as robotic surgery are close behind to replace them. The new sciences are producing remarkable new opportunities, especially with the non-surgical technologies such as artificial organs, prostheses, etc. Some of these technologies will increase the surgeon's ability to perform surgeries, others will replace the need for surgery. The progress from open to minimally invasive surgery has dramatically improved patient recovery and outcomes, greatly due to the reduction of incisions from very large to extremely tiny. All these developments are making the practice of surgery more effective, reducing recovery times, and improving patient results. The practice of surgery is changing faster than any time in the past.